In the hospital's coronary care unit, miracles are a daily responsibility for Dr. Rahman.
When I was very young, I wanted to be a doctor, and when I became a doctor, I always wanted to be a cardiologist. In my world, besides my family, there is two things: cardiology and spare time cricket. Nothing else. Can I have a pair of gloves, please?
An interventional cardiologist, he specialises in using catheter lines inserted into patients' arteries to access their beating hearts.
That's the hot flush coming. We are a very busy center, but we are very fortunate in Gold Coast. We have such a wonderful facility, and we have such a wonderful service.
Up to 10 times a day, Dr. Rahman repairs damaged hearts, while his patients are wide awake.
So the tube is in. You shouldn't get any more pain or discomfort from now on. We got quite a few more patients remaining. It continues the rest of the day, probably until 5, 6, 7 o'clock. And we'll try to do as many as we can. Maria, we put the stent in. I'm very pleased with the result.
Thank you.
Most of the days are busy normally, but unfortunately we haven't had a STEMI yet. So if we get STEMI, then it interrupts the day's planning.
STEMI is medical speak for the most serious kind of heart attack.
This is the medical emergency when the artery is totally occluded and we need to open those arteries very quickly. If STEMI comes, we just prioritize whoever needs to be done first.
Just as Dr. Rahman knocks off for the day, a call to 000 rearranges his plans for the evening.
Ambulance, what's the town or suburb of the emergency?
It's up at Coomera.
Can you tell me exactly what's happened?
I've got like chest pains that feels like someone's standing on my chest.
Okay. I'm going to get you some help there, okay? Did you say that your wife is there with you?
Yeah, my wife and son are here.
Okay, perfect. Now, we are coming to you at the moment.
A 57-year-old man is showing all the typical signs of a STEMI heart attack.
This is Daryl. He's experiencing retrosternal pain radiating down his left arm, suddenly in onset first presentation since about 2:45 this afternoon. Described as heaviness, 9 out of 10.
Daryl, to cut a long story short, it may be that you've had a heart attack.
Any dizziness?
No dizziness, no nausea.
Any family?
Okay, guys, new plan. We're going to go straight upstairs, okay, please?
Daryl's wife, Jenny, has travelled with him to the hospital. There's a lot for her to take in, and things are moving fast.
Well, explain it upstairs. Go, guys.
This is the form of heart attack. We consider it a medical emergency.
Would you like to follow us up?
Yeah. Everything is time in cardiology. When it comes to heart attack, time. Time is muscle.
Do you have any allergies?
If you are late in opening the artery, the muscle could die and they can have quite serious complication from that. So that becomes very, very important. Go, everyone on the run, rush, and then quickly open the artery.
With her husband's life hanging in the balance, the ride up to the cardiology operating theatre feels like an eternity for Jenny.
Is there anything else you wanted to ask at all?
Sorry?
Anything else you wanted to ask at all?
Look, he's in the right place, okay? These sort of things do happen, and we're in the right place to get this sorted out for you, all right?
It's very likely the artery is totally blocked there. So we're quickly going to do an angiography and find out which artery is blocked. And if there is a narrowing, we're going to go and try to put a stent there.
A stent is a permanent scaffold left inside the artery to keep it open.
We're going to go from the groin, which will try to hurry up and speed up the process to open it up.
It's only 10 minutes since Daryl was unloaded from the ambulance. But after a kiss for luck from his wife, the life-saving procedure must begin. Every moment lost, the more of Daryl's heart muscle dies. "57-year-old office manager Daryl is having a major heart attack, known as a STEMI. The blood supply to Daryl's heart is blocked and the muscle is dying by the minute.
We're quickly going to do an angiography and find out which artery is blocked. And if there is a narrowing, we're going to go and try to put a stent there.
Dr. Rahman must find the blockage and restore blood flow before Daryl's heart fails.
Hello, please.
Using angiogram imaging and a catheter fed in from the groin, it's possible to see exactly what's going on inside Daryl's heart. Incredibly, he'll be wide awake the whole time.
It's going to be a little bit pushing in your growing. The tube is coming in. You shouldn't get any pain or discomfort. If you do, please let us know.
Straight away, Dr. Rahman finds the problem.
Daryl, you don't smoke, do you?
No.
Okay. We are about to take the picture of the right coronary artery. There is a narrowed area. Pressure, please. Take a gentle breathe in for me, sir, and hold your breath there. Okay? Breathe normally.
It takes Dr. Rahman just 4 minutes to make the breakthrough.
So the artery that's most critically narrowed, we'll go and try to open that artery. Okay?
Daryl's heart is being starved of blood. He could stop breathing at any moment. This catheter wire is inside an artery that should be full of blood and look more like this. Dr. Rahman's years of experience tells him to keep calm, but get the blood vessel opened as fast as possible.
A patient can die on the table just from the complication of the procedure. A patient can die from the complication of the disease process itself.
Fully conscious, Daryl has no idea how close to death he is.
You're right there, Daryl?
Yeah, fine.
Can I have the tool, thanks?
But his life can be saved using a tiny mesh cylinder called a stent. It's fed in through the femoral artery on the end of a fine wire.
Can I have the Renato wire, thanks, and the introducer, thank you. Just going to go a little bit further. It's very important to keep calm and quiet during a difficult procedure when the patient is very unwell. We'll take a picture, please. Thank you, yeah. You may get some chest pain. We're inflating the balloon now.
Once it's in place, Dr. Rahman inflates a balloon inside the stent. But will it be enough to open Daryl's artery before it's too late? "57-year-old Daryl has had the classic wake-up call health scare.
You may get some chest pain. We're inflating the balloon now.
Dr. Rahman has just inflated a balloon inside the stent, opening it to the size of the artery.
If you go up there, please.
Going up now?
The impact is immediate. From an empty blood vessel
Save that picture for
to
me,
a
please.
full one in seconds.
So the artery looks open now. Show me there, please. Daryl, the artery is nicely open now. We're just going to do some fine tuning. Is the still a little bit of pain, or is it gone? So it should start to ease off very soon. Yeah.
And with that, Dr. Rahman has finished another life-saving surgery in record time.
Everything went very well. We did the total procedure from the time he came into the hospital in 23 minutes. So that's going to save a lot of his heart muscle. It's very rewarding to see very sick patient coming to us, and we intervene, and straight away they're totally different. They feel so much better.
Did you feel that at all?
No, that's good.
But Daryl isn't out of the woods yet.
There is some damage in your heart muscle we can see from the heart attack. I always tell my patients, we have stented your artery. That's not the end of the problem. The disease process, you have to work and improve that by lifestyle changes and by taking medication regularly.
What if I lose myself? What if I choose to let it go? I wanna let you and me collide.
2 months down the road, Daryl has made the changes and is starting to enjoy the benefits.
The weight I've lost is probably about 6 kilos. Feel great. The change was just so easy. I had to roll with it. I've got a 10-year-old son, my wife. I had to think of them as well and make these changes and make it all happen. Yeah. Ready? We start feeding. If I go back to my old ways of all the fatty foods and that, I'm not going to be here in 5 years. And that's why it's so important to keep up with your healthy eating, your exercise. Listen to what the doctors have said to me, and just carry on with it. The end result is I'm here, made the changes, and looking forward to many years in the future.